Hello, today we will present about edema, anatomy and pathophysiology. 1/3 of total body water is extracellular space and 2/3 is intracellular space. Extracellular space is composed of the intravascular plasma volume 25% and the extravascular interstitial space 75%. Edema is defined as a clinically apparent increase in the interstitial fluid volume. Weight gain proceeds over edema. Anaska refers to gross generalized edema. Ascites and hydrothorax refer to accumulation of excess fluid in the peritoneal and pleural cavities, respectively, and are considered to be special forms of edema. The first one is pitting, and the next one is anaska.
What is the cause of edema? If the capillary or tiny blood vessel leak fluid into the surrounding tissue, the area will start to swell. This could be due to capillary damage or increased pressure. For the symptoms of edema, you might see swelling or puffiness of the tissue directly under the skin, a stage of shiny skin, skin that remains a dimple after being pressed for several seconds, and increased abdominal size.
The picture shows the fluid is hydrostatic pressures from anterior end to tissue, and fluid from tissue to venous end. This shows the 5 factors. It's increased hydrostatic pressure, reduced oncotic pressures, increased blood vessel wall permeabilities, obstructions of fluids carrying via to lymphatic system, and change in the water retaining. The issue of the approaches to the pancreas via edema, generalized at liver, kidney, nutritionals, localized venous obstructions, lymphatic obstruction.
Why does a patient with heart disease retain fluid? Heart failure is the result of poor cardiac function and is reflected by a decreased volume of blood pumped out by the heart. Heart failure can be caused by weakness of the heart muscle, which pumps blood out through the artery to the entire body, or by dysfunction of the heart valves. Decreased cardiac output is responsible for decreased flow of blood to the kidneys. Why does edema occur in patients with kidney disease? Edema forms in patients with kidney disease for 2 reasons. The first is heavy loss of protein in the urine, and the second is impaired kidney function or the renal functions.
Result in a increased flow of blood to the kidneys. The kidneys sense that there is a reaction of the blood volume in the body. To counter the seeming loss of fluid, the kidneys retain salt and water. How does renal insufficiency cause edema? Veins of the leg have valves that prevent the backward flow of blood within them. What is the idiopathic edema? Idiopathic edema is a pitting edema of unknown cause that occurs primarily in premenopausal women who do not have evidence of heart, liver, or kidney disease.
Thank you for your attention.